Would the Honourable Minister please proceed with his statement?
Thank you, Madam Speaker. I would like to update the House about the issue of the use of opiates, both prescription and illicit, in Manitoba. I'd first like to acknowledge the many lives that have been tragically impacted by addiction or death as a result of opiates such as fentanyl and carfentanil. While there has been discussion and debate about defining this collectively as an emergency or a crisis in Canada, we need to be clear that the families who have lost a loved one to an overdose, for them, this is clearly a crisis. For those who are battling an addiction, this is clearly an emergency. I'm informed by the medical examiner's office that there have been a total of 9 overdoses where fentanyl was confirmed as either the primary cause of death or a contributing factor in the first 5 months of 2016. I've been further advised after asking for information that this number is expected to go up, but that there are a number of toxicology reports that are outstanding. Based on what the medical examiner is advising me as of today, we've seen at least 24 overdose deaths where opiates of all classes were found to be present in the toxicology reports in 2016. Sadly, we know that as test results come back from other suspected overdose cases, that number will rise and will almost certainly be higher than in the previous years. Every province is facing a tragedy of opiate addiction and deaths that are resulting. Last week, I, along with a number of other ministers of health and the Chief Public Health Officer of Manitoba, met in Ottawa for our national summit on opiates. I want to extend our province's thanks to the Federal Minister, Dr. Jane Philpott, and Ontario Minister, Dr. Garrett Hawkins, for hosting this summit. Health professionals from across Canada representing dozens of organizations came together and committed to specific actions within their disciplines. There will be ongoing accountability and reporting of the success of those commitments. The entire joint statement of action developed at the summit is available for members of this House and the public on the Government of Canada's Health Department website under the substance abuse topic. Manitoba, along with other provinces, made several commitments. Together with other jurisdictions, we have committed to better tracking and reporting of overdoses so that we can better determine the depth of the problem and the expectations of improvement. As well, we are committed to providing specialized education for service providers and parents and a renewed public awareness effort. Many of those who are dying from fentanyl and carfentanil are unaware it is the drug that they are taking and unaware of the deadly consequences. More awareness and education is critical. As well, we will expand the availability of naloxone to help reverse overdoses. However, it must be stressed that having a naloxone kit is not a safety net. It may mitigate, but it cannot eliminate the incredible risk inherent with using these drugs in an illicit fashion. We know that drugs and those who sell them do not respect provincial boundaries. That is why we need a national effort on this issue. Last week, Manitoba again emphasized this to the federal government and advocated, and we will continue to advocate for the restriction of the sale of pill presses, along with stronger enforcement against the importation of fentanyls from countries such as China, and the enhanced ability of the Canadian Border Services to better detect fentanyl coming into our country. These were measures that were supported by law enforcement at the summit. Madam Speaker, while government can and must take action, it is not a problem that can be legislated away. Addictions is very much an issue of the heart, often broken, often wounded, and often hurt hearts. We need all Manitobans and organizations to take up the call to support each other, neighbors helping neighbors, students helping students, and friends helping friends. Finally, I'd like to make special mention of those who are on the front lines responding to the far too many difficult overdose calls that they are receiving. Our emergency responders and medical professionals are also dealing with the trauma of these situations, and we cannot remember them often enough for the very difficult work that they do. Madam Speaker, I thank the House for this opportunity to provide an update, and I thank all members for their concern that I know they have for this issue. Thank you.